Warm greetings. Today I'm starting a fresh playlist that talks about a medicine you might be on. The first medicine we are going to cater to is one of the most common ones, that is, if you are on metformin. We are going to understand everything from why it is being used, how it works, its expected outcomes, unexpected outcomes, and many more quirky facts. So let's get started. So the first question that we are going to cater to here is the what. What is metformin originally? It's a hypoglycemic agent that is formulated as an oral tablet in doses of 500 or 850 mg. What is its use? It's used most commonly to improve blood sugar levels in adults with type 2 diabetes mellitus. Here I'm hoping to give you a little background about diabetes. As we know, it's one of the most common metabolic disorders that is more of a lifestyle oriented disease which comes with multiple manifestations of increased urination or increased thirst and very high blood sugar levels that can be treated with a first line treatment of metformin. A rather unknown fact is that metformin is also used for polycystic ovarian disease. Now that we know what metformin is and what it is used for, let's get into the how. How does it work? Metformin is believed to help your body respond better to the insulin that it naturally produces. So there are two kinds of diabetes. There's one that is type 1 diabetes mellitus and then type 2 diabetes mellitus. In type 1, the body itself does not produce enough insulin. And that's why the treatment is insulin. But in type 2, insulin production is sufficient, but there is a certain amount of resistance that is coming from the body to accept the glucose from the blood into the cells. And that's why, since the sugar or the glucose is not being transferred from the blood into the cells, it remains in the blood, increasing the levels and causing diabetes. How metformin works here is it decreases the amount of sugar your liver will make. So that way the count decreases by itself. Second, it decreases the amount of sugar your intestines absorb. So that way, even if the sugar is not being accepted into the cells, at least it's not at such a high concentration that it can damage other tissues involved, right? So let's move on to the next how. How much to take? Your doctor will tell you how much medicine you are prescribed and when to take it. You have to follow the directions always and avoid missing any dose and cater to all the counseling points mentioned by the doctor. Taking these medicines with food is often advisable because it will reduce in case you have any nausea or vomiting, okay? The second how. How are you supposed to take it? Well, it's an oral medicine, so please take it orally. A lot of people have a question about can it be crushed or anything, because few medicines come with the notion that you are not supposed to crush it, but metformin can be split into half. But don't take the half dose. Maybe if you have a swallowing difficulty, just split the medicine for ease of swallowing and then take both the halves together, right? Moving on. How are you supposed to store it? Simple, at room temperature, and throw away the outdated medications because this is a metabolic condition and we do not want to mess with it, right? And you have to make sure that you keep it out of reach and sight of children. That's important because in case they ingest these medicines by mistake, it will be counterproductive, right? The next how is, how about I miss a dose? If you forget to take metformin, do not double the dose. That is one thing you're never supposed to do because it risks hypoglycemia. So you're not supposed to double the dose to make up for the forgotten one. It's just if you've missed it and a larger part of the day has already passed, take the next dose whenever it has been prescribed. Okay? And the last how here is, how about an accidental overdose? I may not be yelling, but I want to. Because if you have taken an accidental overdose, irrespective of the symptoms you are expressing, you have to consult a physician, especially if it's probably, I don't know, by mistake 5 6 tablets or something. Even if the body is not showing the normal increased tendency or side effects that could have been seen, like stomach discomfort, nausea, vomiting, diarrhea. I mean, if you see these effects, certainly go to the doctor. But if you don't, also, you can never be too safe. So just go to the physician or a hospital emergency department and get your blood sugar checked, because in such things you cannot wait for a fatal emergency to come. It can be life threatening. So kindly avoid, but in case it happens, do not panic, just go and get yourself tested, right? Moving on, now we know the what and the how. Let's understand the effects I did not pay for. These are the side effects we are looking into. The most common adverse reactions associated with metformin administration are diarrhea, nausea, or even a little gastrointestinal upset. But I have to tell you, metformin is one of the most safest medicines that is being prescribed for diabetes, and it has been prescribed for a lot of years now. So we have a backup of data that suggests that it's a medicine that even on long-term administration does not have hazardous side effects that we need to worry for. So this is a very safe medication. If you have certain troublesome symptoms, inform your physician and it can be catered to separately. Apart from that, there's one serious but very rare reaction that you should be aware of. It's called lactic acidosis. It's not something that is self-diagnosable, of course, but in case you are, as in the case of an overdose, experiencing something that is out of the ordinary, mention it to your physician. And one side effect that we can see with any hypoglycemic agent is hypoglycemia. That means you take the metformin and you have high blood sugar and it comes to normal. That's what we want. But sometimes maybe the dose was a little strong or you ate less, so the blood sugar was relatively normal, and upon ingestion of the medicine it actually became very low. So the symptoms of hypoglycemia should be imprinted on the patient's head, and he or she should know that if I'm suddenly dizzy or there is a certain kind of weakness in the body, you have to identify that as hypoglycemia and firstly eat something sweet or immediately get yourself tested, right? So hypoglycemia is something you have to be aware of. But if you're on this medicine for long enough, I don't think it's going to be something that will come out of nowhere because you're taking it on a daily basis, right? But there's only one thing on long-term administration that is known, that is serum vitamin B12 levels are reduced in some patients when they are receiving long-term metformin therapy. But not to worry, your pharmacist or your physician will take care of that as well by providing supplementation. The next thing that we need to understand is the drug's social life. I know it's funny, but what it means is a drug interacts with other drugs. It interacts with certain herbal substances, or it interacts with some of your lifestyle habits. Okay, so we need to see what we can do about it. Firstly, related to drugs, the kidney is the main route of metformin elimination. So interactions involving competition for metabolism by liver enzymes are uncommon. If you don't have a lot of background data about it, what it means is that metformin does not have a lot of interactions because most of the interactions with other drugs come because of the liver. So since it is not very dependent on the liver, interactions are relatively less. But if you take it with another hypoglycemic agent, like another medicine for sugar, the levels of sugar might fall down drastically. So that's one interaction the doctors are aware of. So you don't have to worry. It's just you're supposed to know, if I am starting myself on a new medicine, I have to inform my physician, the one who's prescribing me this new medicine and the one who has kept me on metformin, that yes, I'm on metformin. So is it cool that I'm taking this new medicine also or no? That's it. Apart from that, relating to the lifestyle habits, there is certain caution against acute or chronic alcohol intake, okay? Because alcohol may potentiate the anti-hyperglycemic effect of metformin. Okay, so you have to look out for hypoglycemia. A relatively normal amount of alcohol once in a while is fine, but chronic intake is not suggested with this medicine. Just keep that in mind. Moving on, the I warned you points. These are certain precautions that you're supposed to keep with you. That is to help avoid any untoward effects and ensure proper use. Talk to your healthcare professional before you take metformin or before you start any other medicine with metformin. Talk about all health conditions that you have and the problems that you might expect, like in cases of renal failure, liver disease, or other lifestyle habits, including smoking, alcohol, or if you're expecting pregnancy or if you're lactating. These are some things that you have to keep it in the clear with your healthcare professional. In case there are any changes that are expected, they will be made. The last thing over here is the nerdy enough to take away. This is one interesting fact about metformin that you're supposed to know. Please remember it. That adequate control of blood glucose is crucial, of course, in maintaining micro and macrovascular complications. Diabetes is a chronic disease that one has to live their life through, right? So it's not something you take for 5 days and the cold is gone. No, it is going to stay. And what we are doing by keeping the blood sugar within the normal limits is to prevent any kind of vascular complications that can damage your eyes or your kidneys or even your nerves. So our primary aim is to avoid any kind of complications as a healthcare professional, right? So when a healthcare professional is giving you metformin, it is intended as an adjunct to appropriate diet and exercise, not as a substitute. I will read that again. Use of metformin is intended as an adjunct to appropriate diet and exercise, not as a substitute. So this medicine will help you reduce the blood sugar level, but it cannot substitute what diet and exercise could have done. So you have to take care of your diet. You have to consume relatively less sugar, and you have to provide your body with continuous exercise, 30 minutes a day, every day in a week, right? Because there's this saying in the profession that says that if I give you a medicine, the medicine can reduce 33% of the blood sugar level. Another 33% of the blood sugar can be reduced by diet, and the last 33% of your high blood sugar is reduced by exercise. So no matter how much metformin I give you, it is going to work only on 1/3 of the high blood sugar. The remaining 2/3 is in your hand by your diet and exercise. So I hope you look after your health, and I hope you found this information useful. This is signing off. Yours sincerely, the Nerd.